This video was made possible by the Laurel Foundation, Bay Area Lyme Foundation, and the Limelight Foundation.
Lyme was never on my radar. What I did know about it was that it was something that happened on the East Coast, and I had no awareness of it whatsoever.
Lyme disease and tick-borne illness is really an epidemic in the United States.
I had a bullseye rash in about 1991, and it developed underneath my hiking sock, so I literally pulled down my hiking sock and I saw this raised pink rash.
I had been to many doctors, as most Lyme patients have, and was dismissed.
Oftentimes when patients come to me, they've seen many practitioners of all different sorts trying to get answers. Chronic fatigue, fibromyalgia, and depression are the top 3 that people have been diagnosed with.
And when they don't know what to do with you, they just sort of say, well, you're stressed out, you're overweight, you need to exercise more.
The standard approach to do testing for Lyme disease is what we call an ELISA test. If that one comes back positive, then we do a follow-up test called a Western blot.
It's just appalling. The quality of the testing has not improved.
There's a lot that we don't fully understand, and the tests often miss cases, so we don't have absolute tests that we can rely on.
And so you fall through the cracks again and again and again with no diagnosis, and you get worse and worse and worse. When Allie was diagnosed with the Lyme, it was a bittersweet moment. We were excited to hear that she didn't have lupus, but we were also heading into uncharted territory.
I remember taking a really big breath and just being like, okay, let's do this. I'm ready.
There's the part of caring for the human being, because these people are sick.
Ultimately, I was on antibiotics for 3 years. I still had some symptoms, and so we then went on to IV antibiotics for a period of about 9 months.
There's herbs that are both antimicrobial, that also kill organisms. There's herbs and other forms of treatment that enhance the immune system's own ability to fight the infection.
Lyme disease is a multisystemic illness, and so you're typically experiencing dozens of symptoms at a time, and that is not an exaggeration.
Last weekend, for instance, my palsy came back, and it was devastating. It's been gone for 9 months. I thought we overcame that.
Sleepiness, tired, those aren't words that can describe what it's like when you are dealing with chronic fatigue. It is a whole other ballgame.
This is crippling fatigue where I can't even lift my limbs.
Brain fog and confusion, the inability to act. You're helpless, completely helpless. It's been devastating.
You get to a point where I would look in the mirror and I would look so tired and pale that I wouldn't even recognize myself.
It's like a puzzle, and I learned to accept very quickly that every doctor maybe only has 1 or 2 pieces to the puzzle, and that's okay.
To maintain resolve and strength and optimism when, I've been spending years trying to get well.
I've met some of my best friends who have Lyme disease or other illnesses in IV rooms. They are your golden ticket to your social support. Everything you need that the other people aren't giving you are the people going through it just like you are.
It's really important to have a circle of people surrounding you. You can't do it alone.
I think that getting Lyme disease was a blessing and a curse, but it's also provided me with this whole new perspective on how to heal.
I knew that I needed to be making people aware. It kind of put me in a position of, well, if you're not going to know about it, I will teach you about it.
There is that message of hope, and people really need to know that they can get better and they will get better, and it starts with an accurate diagnosis.
That gives us hope that, Rachel can lead a normal life, and she hasn't given up on that, and we haven't given up on that.
I know that I'm so much better from where I started, and I just know that I have so many more good days to come and great things to accomplish.
It's like, okay, I'm here. I'm getting through it. I'm just grateful to have made it to this point.